Alright guys, so in this video we're going to talk about a SCAD, or a spontaneous coronary artery dissection. So this is an uncommon type of heart attack, so it's relatively rare, and we're still finding out a lot more about this as we go along. So basically what it is, it's a type of heart attack that is more common in younger individuals, usually women in their 40s and 50s, but can also be younger. Linked a lot with ladies in their postpartum, so soon after giving birth, in the months or early years, which is a little bit stressful on top of everything else maybe dealing with in those times. But it is a type of heart attack where, unlike during coronary artery disease and atherosclerosis, where you get this build-up of plaque that narrows over time the size of the blood vessel, it's where you get a tear in the lining of the blood vessel that kind of flaps over and blocks the blood flow. Or you get this tear and you get a pooling of blood in the wall of the artery that kind of closes off and reduces the blood flow, and it can cause chest pain or discomfort. It is a hard one, so they're still learning a lot about it and deciding what the best treatments are for it. It can be hard to know because it tends to be women that don't have any other risk factors for heart disease, so not overweight, they tend to be fit, healthy, eat well, which is even more annoying. And then if you're then dealing with the fact that you've got a relatively young baby or child, it can make the recovery process harder. They sometimes do stents, but then sometimes they don't. A lot of the times they try to manage it very conservatively, so they will put you on beta blockers that will keep your heart rate and your blood pressure low, and just let that tear heal by itself over time. So it can take up to 12 months, maybe even longer. And unfortunately, once you've had one, you may be at risk of future ones as well. So it isn't triggered necessarily by exercise or by any other known trigger. They're not entirely sure what happens, but it may be linked to some connective tissue disorders as well. So usually if you have it, you may or may not get tested for it, depending on where you're at. And the recovery from a SCAD heart attack is usually a lot more progressive and low intensity, so it's getting back into exercise very slowly and at a much lower intensity, and it's more about keeping moving rather than necessarily making all the traditional changes that you might have to take after a heart attack. So managing your salt intake, your diet, which again, you can look at all that stuff and it's definitely going to be beneficial, but you may have already been doing all that beforehand. So it can be very frustrating time, and there are some really great support groups online for these ones as well. So if you have any questions, or if you're feeling really alone in this, please don't hesitate to reach out to us, and we're more than happy to point you in the right direction.